This morning on Insight, I'm here with Dr. Ron Cohen at Cohen Orthodontics, and we're going to talk fast braces. And I'm guessing they're not like speed car braces, you know, they don't look like Lightning McQueen or anything.
No, they don't. They do have their own song, though.
Oh,
but
are you going to sing it?
No,
Okay.
no, I'm not going to sing it. You won't want me to do that.
What are fast braces?
Fast braces is a system that was designed by Dr. Viasi in Dallas, Texas. It's been around, he's been developing it for about 20 years, a friend of mine that I've known for quite a while and have spent some time with. And my thirst for advanced technology, you know, this kind of brought me to his system. It is a bit simpler than the SureSmile system that I do, but in many instances it gives us the ability to move teeth and roots together at the same time to cut our treatment time down tremendously. Majority of cases can finish anywhere from 3 months to a year. If you have huge skeletal problems, big overbite difficulties, underbite problems, impacted teeth, those kind of things, that really doesn't work for that, but for you know, for a good 50–60% of the cases, it is an option that we now offer that will allow our patients to get done much quicker than what they ever could before.
Do they look like regular braces?
Actually, they don't. You know, the picture that we'll look at, they look more triangular.
Okay.
And the reason being is that when you look at a normal brace that we call it a twin bracket that has two sides to it, and then there's a space, and there's another one that has two sides to it. Those are twin brackets. You have a certain amount of inner bracket distance, all right? And it's the inner bracket distance that causes the stiffness of the wire to be expressed when you put a wire in, okay? These brackets are more triangular in shape. In other words, they have a bar that goes like this and another bar that goes up like this, but the point where the wire meets right in the middle, the space between that and the next one is about 3 times the length of what it is for a twin bracket, right? And when you add that special, that long span in there, it increases your ability to put force on the teeth and decreases it by a cubed. It's a logarithmic type scale type thing. And so by decreasing the amount of force that you put in, you can put in a full-size wire right in the beginning, which allows you to not only move just the crowns of the teeth, which is what we've done traditionally in orthodontics, which is why it took 2 years for most cases to get done before we started doing SureSmile. It allowed us to, you had to move the crowns first, and then you had to take the next year to catch up and move the roots along with it.
Okay.
With fast braces, they happen simultaneously, so you can get it all done at one time.
Is it better for, is it something you're using more for adults who are coming in, or is it something you can use for children, teenagers too?
It can be used for any age, yes.
What would you say the percentage of people coming into your office that you're using fast braces on?
I would say it's probably right around 50%. There are positives to it. There are things that you can accomplish with it that you can't with other systems. There's things that you can't accomplish that you can with other systems. And so in my practice, it is definitely one of the main supplies that I have in my armamentarium to solve patient problems. And in many instances, we'll lay out what we can do with fast braces versus what we can do with another system to our patients and give them the opportunity to make that decision. Fast braces will be financially a bit more affordable just because of the way it's designed. In many instances, it'll be just as fast as my SureSmile, maybe faster sometimes. But when I have a really large, in-depth case that we have to do surgery on or something like that, then it won't work for that, and then we have to go to the other side. So there are, it can be used in a lot of different cases. And one of the cool things is that because it is more of a national network that's kind of being developed, we also have a long-term warranty on treatment. And as long as you wear your retainers, if something kind of changes, then that can be taken care of at any fast brace outlet.
Oh, that's nice. So let's say I'm here and I move away.
Right.
I've been wearing my retainer, but for whatever reason I get, you know, a tooth that is not cooperating, and then I can go see whoever does that in that market.
Exactly, exactly. And there still is a little bit of a fee involved. It's not a full-on whole treatment thing, and really the fee mostly is for new retainers and new records and all that, and for the most part, actually re-straightening a few teeth that have moved a little bit, there's not an additional charge to do that.
Because we all know as we get older, things just change a little
Unfortunately,
bit.
everything changes. The whole body does, yeah.
That's just a shame, that whole getting older thing.
That's the next thing that I have. I'm going to try to fix that, too.
Okay, let me know how that works out. Well, if you want to check out this new alternative, not new, but quicker alternative, maybe Fast Braces here at Cohen Orthodontics, give them a call today. They have offices in Fort Wayne and in Churubusco, or you can visit them online, DocRonSmiles.com.